CAR-T is really a unique kind of therapy. And from a patient perspective, we're looking at a group of patients who are used to more traditional therapy with, chemoimmunotherapies. And oftentimes, especially if we're looking in diffuse large B-cell, where there is a good response overall to initial therapies, it can be quite a shock when they relapse and get to the point where they need CAR-T. Overall, though, what we have seen with patients that have had CAR-T really is an increased level of stress and anxiety than what we would see in a matched population. And this can relate somewhat to the conversations that are being had with their doctor, how they're presenting CAR-T. How many times has a patient relapsed, and do they think that this is their last chance? And if it doesn't work, then there's no more opportunities for them for therapy. It can also be contributed because of the nature of CAR-T. In fact, that their cells are being modified and then reinfused is kind of a scary proposition. When patients are faced, with that final choice where those cells are being reinfused, we really see some hesitancy because of some fears around that modification. A lot of this could be resolved with better information provision and perhaps some different levels of communication with a healthcare team, so a patient understands what is about to happen. As well, where we see some gaps with patients is really as to what happens once they get sent home. So when the CAR-T cells have been administered and they've been through their initial hospital stay, if that's something that is required in their protocol, and then they get home and they're not feeling well right away, and they again have high levels of stress and anxiety. And as well, but for the caregiver who's providing some key role at this point in that patient's care, but also in very practical things. Oftentimes, our healthcare professionals really focus on the big side effects, and they're worried about things like, neurotoxicity, or they're worried about CRS. But from a patient perspective who goes home and they're still losing weight or are experiencing headaches and rashes and prolonged fatigue and worried about their B-cell count and if it's coming back and their susceptibility to infections, especially in light of the pandemic, these things become bigger for the patients, and they're not always well addressed or well prepared for what's going to happen when they leave that hospital. And so those are gaps that we face. And of course, depending on where you live in the world, the financial toxicity is something that is a big barrier for patients, whether or not they can afford their portion of the treatment, whatever that might be. And sometimes that is governing a patient's decision rather than what might be best for their health situation overall, is really how are we going to pay for this or pay for our portion of this treatment. So really quickly, that was just a brief overview of some of the challenges that we see our patients facing.